Let's get going into this. All right, welcome everybody to this month's September 2025 episode of our SCIP meeting, our Stanford Community of Improvement Professionals. I want to give everyone a rundown about what we'll be doing today, and it's based on the feedback from last time. So if you weren't here for the last meeting, you'll want to go after this and go to our website, the SCIP website on smci.stanford.edu, and check out the recording. Jake did a great presentation on adoption, spread. This image that we've got here on the screen of this like AI generated, of course, there isn't something like this that really exists, where spread is dead. We were wondering if really it was, and the discussion was really great. The feedback we received, I'm going to go to the bottom here of our page. Hold on, let's just zoom to the bottom. So when some of the things that people liked, they liked the content, examples, call to action. They liked the idea of puppy adoption, how it was tied to, okay, how do we get people to want to adopt these changes? And so the concept of puppy adoption was used. And so some of the things that the people wished is that we, instead of having individual breakouts, hold on a second. Instead of having individual breakouts, what we would do is maybe have a bigger group discussion so that everyone has a chance to hear what everyone else is doing, versus we're all in different rooms, we come out and then we miss the entire conversation. Also, the feedback was people are on lunch during this time, and so sometimes they're not always able to engage, but they want to listen. So they want to be able to hear that. So based on some of those things, as well as people were wanting to continue with the conversation. They loved the conversation. They felt like this is something we should sit on and really spend some time on. So what our team has done, so Dakota, Jake, myself, Kim, Ty, we've got a group working on some of these concepts. We've been working between the last session and this session on some questions, on some ideas, and we thought we'd bring it back to this group and float some of the things that we've been discussing and be able to hear from you on what you think about it, and then also get your feedback on your thoughts to build on this conversation that we had, because it was so rich. And then the final things, I think that was largely it. I just wanted to give a sense of what the feedback was from last time, to let you know that we do listen to the feedback and we adapt accordingly. So with that, I wanted to I thought I'd give a little icebreaker, a couple of things. What I would like to know, and you could put this in the chat or you could speak up. We've got a small enough group. You can come on camera, or you don't have to be on camera. You could just share. Two things I'm going to ask. The first thing is, of course, sharing your name and where you're at. But what was, school started for most kids last month or this month, so between the time that we just last met and now. So what was maybe the when you think about your early education, what was one thing that really stands out? Like, it could be a award you won, it could be an embarrassing moment, it could be a teacher you really liked. I'd love for you to share that. And then also this question, you can chat in this question. How do you define the following words, and are they different? Adoption, spread, and scale. An interesting question that we were wrestling with ourselves a little bit. So 2 questions. I'd love for you to come off mute and share, if you would.
Ryan, I can share.
All right.
So for school, the first question, I went to school in the Philippines, but I went to actually a Chinese Catholic school. It was very strict. We had priests who were very strict. But then I loved it. One of the things that I carried, like, that really stood out to me was the discipline that we actually remembered. If you're late for by 1 minute, you get, like, that first class, you get to clean the whole campus. Then you're never going to be ever be late. Things then too that you pick up, like, when throwing trash, I always have like, when you're eating, like, and I kind of teach my son this too, is just put it in your pocket. I still do it every single time. And I feel like, and then when you just, like, find a trash can and put everything out, like, and like just those discipline. And I think that you can bring, like, teach your my son. I only have one kid, so two. Um, Number two, how do I define? Because adoption is that you're actually learning something and being applying it into your own work. Um, Spread is sharing, teaching. And scale for me is that you can start like a pilot and then you increase it. That's kind of how I think of it. But all right.
Awesome. Thank you for jumping in, Amy. It was great. Suki came off mute. I saw it.
Hi, everyone. I'm Suki Sung. I'm one of the nursing professional development specialists over here at Stanford Healthcare Tri-Valley. Do a lot of work in organizational development and working on these hot topic items of improvement. And so, yeah, childhood memory of early school would be I was born and raised in England, raised in a very an environment where there was very strict also rules. And one of the things is a very key just memory, like as you said, what you were saying, I thought of the uniform that I had to wear every day at a public school. So just being able to wear a tie to this day, like I know how to do that. And my kids are like, how did you learn how to tie a tie? You don't wear ties. So that was kind of a fun fact slash early childhood. The discipline that is needed, right? In that environment is real. Like your tie could not be off. Like it was a thing. Like it had to be a certain length and the knot was a certain way. So, and then to the question around defining the following words, I think you did a great job, Amy, of really speaking to how you perceive them. I think when I think of adoption, I think of it like it's a choice, a decision to say we're going to do this now, right? It's a choice. It's like I'm going to do this. Like I'm taking it on. Spreading is really again, how do we best share this information that is received well and it's getting back to the adopted almost like it's engaging. Can't just spread like butter, right? But just spread in a way in which is, it's viable. That's what that means to me. And then scaling, right? You're going from one department to the entire organization. What does that look like? What's needed to be able to sustainably make something be active in all areas? So thank you.
Love it. Thank you, Suki. How about maybe one more? And you can answer any of the questions. You don't have to. You don't have to answer both.
I'll go off. I think we had 2 international schools. I went to school in America. It was very classic. I like that you guys both said discipline was a standout. I said discipline was not a standout in my education. We had no uniforms. I don't remember being punished severely for being late, or maybe I just was never late. I rode the bus. The bus gets you there on time. I do have a strong memory though of once I got on the bus, and as the bus was turning around my cul-de-sac to leave my neighborhood, it broke down. So I was across the street from my house. and they would not let me off the bus. I had to stay on the bus. We were on there for like 2 hours, I want to say, before they eventually called our parents and said our parents could take us off the bus. But that's,
And you walked across the street.
yeah. But I was like one of the first people picked up, so it was only like me and like other people in like my neighborhood. So we were all like, I wish we could go home. We couldn't.
Oh man.
Um,
Oh, that's good stuff.
yeah, but I definitely don't think we had to clean the school. We definitely didn't have uniforms. I definitely agree with
No, I'd say my.
Oh, go ahead.
Oh, go ahead. Keep going.
No, I was
No,
just
keep
doing
going.
topics. So,
Go ahead.
okay. I was gonna say I agree with the adoption spread scale that everyone said. I think of adoption more of like a one-on-one choice, and it's probably focusing more on the person receiving the information. Am I choosing to adopt this thing coming towards me? I think spread happens a little bit more. Like it can be intentional spread, but spread can also happen accidentally. Like an idea happened, and it's sort of like just naturally spilling out onto the world around it sometimes. Sometimes we're trying to emulate and force that natural spread out. And scale, I agree. You're thinking about how you take this idea that was created in a small environment, a one-on-one environment, and how do you make it apply to the larger environment? Oftentimes that means simplifying, expediting, making interpolations to allow it to scale like that.
Love it. Love it. Anyone have anything that is dramatically different? Okay, so Joe says adapt equals buy-in, adopt ownership, spread is culture. Oh, okay, cool. Good. Well, wonderful. Thank you for leaning into that a little bit. I know not everyone got a chance to talk. I would love for everyone to feel comfortable speaking up in this environment, because this group is really meant to not only talk about concepts, but get us to know each other so that when we do work on these things, such as scaling something or spreading something or adopting something, we know each other, we've worked together before, we are able to be able to pick up quickly and have an element of trust amongst each other. So what I would like to do now is I would like to introduce my colleague, Dakota White. I don't know if all of you know Dakota. Dakota is part of our improvement team. She's so much fun. You really will enjoy her. She has agreed to share some of the things that the team here within our improvement team here at SHC, we've had a chance to discuss some of these topics, and we wanted to pitch some of this stuff to you and see what y'all think. We have some questions that Dakota will share with you as well, but I wanted her to give a bit of background, assuming that all of you have access to, even if you haven't watched the previous session that we had in July with Jake. So if you didn't, again, reminder, go back, check that one out. It's on our YouTube channel and also can be found at smci.stanford.edu. Okay, with that, I'm going to stop sharing and I'm going to pass it to Dakota. Go ahead.
Thank you, Ryan. Let me go ahead and share my screen. Okay, I believe you all should be able to see it now. Perfect.
Yes, we can.
All right, so I won't represent what Jake went over in the last session, but I was very excited to hear that the feedback from that last meeting had been very positive, and there was an appetite to continue the discussion. For full context, the improvement team every year, so again, that's the group that Jake, Ryan, myself, and a number of other people that I'm sure a lot of you are familiar with, we do internal annual planning for our group. So in addition to looking at what has been put out for the ops plan or every couple of years the ISP, we also say, what are things that we worked on this year? What went well? Where do we think are gaps that we can or should fill in? And then from that list, we pare down and prioritize on what we think we can actually tackle. And so right after Jake had given this presentation, we were in the midst of doing that for our team. And one of the things that a lot of us were interested in trying to focus on for FY26 and moving forward was this concept of spreading or sharing best practices across our clinical team. So the timing ended up absolutely perfect. And again, I think hearing that you all were interested in continuing that reaffirmed that we were on and hope to be on the right path moving forward. So one of the things that I know our group wrestled with, and we're hoping to get confirmation from this group on, is the concept of why this, why now, right? So Stanford has a unique model for improvement with, for example, the Improvement Capability Development Program. We have a UBMD PCM dyad structure set up on the inpatient setting. And so why does this concept of adoption, spreading, or scaling matter? I know there have been a number of announcements over the last couple of weeks that have been sent out by email that for the inpatient group, we were in top 5, top 10 for Vizient at number 5. For ambulatory, we came in at number 6 out of 66, for outpatient services. And so I think looking at where we're at as an organization, and really leaning into those improvements and outcomes definitely ties us back to the success that we've had this last fiscal year that has taken a lot of time and intentionality to reach those points. But it's not just enough to say, okay, we've achieved those levels of success, or we've obtained X number in cost savings, right? So I think for us now, it's switching gears and trying to maintain that momentum and that appetite to really understand what's working well in some of these areas and making it visible and also usable across the system. And so we think that because we have continued to improve in our national rankings, but also in our patient outcomes and from a dollar perspective, we really want to continue focusing on not letting good work live in pockets and start to scale it for broader patient impacts. So, what we are proposing, and some of this is courtesy of ChatGPT, the fancy name, right? So nothing on this slide has to stick for now, but we thought about something called the Stanford Improvement Exchange, or SCIP for an acronym purposes. And we really want to focus on, again, moving from those isolated successes to a system where we have proven practices that are easy to find, also easy to trust, because we know that they have been successful and sustained, and then adopt. And so that's kind of what we want to lay out today and get your input on. So from Jake's prior presentation, just reiterating that we do want to propose a system-wide program or a platform that essentially helps to take the guesswork out of improvement. I think too often when one team solves a problem really well, and I'll use an example, I was directing a right cohort last year, and it was themed, so reducing falls with injury. And a lot of the areas were oncology specific. So across our hematology, oncology, and BMT units, we had participation. And there was a lot of success with some of the interventions that our hemonc units came up with. And from that, they were able to see measured or remarkable decreases in falls with injuries for their patients. And I think it just kind of stopped there, right? Like they specifically were utilizing orthostatic vital signs as an indicator of whether or not there was a high correlation with patients maybe falling when they got out of bed. As far as I know, I don't think that we have presented that pretty broadly to other inpatient units in the hospital. And again, because they had success, one of the things that we could have and should have looked at is, okay, well, how then do we share that information or provide the resources that we utilized to other areas so that they can adopt it and hopefully continue to see a decrease in some of those events on their units as well. But not just in the inpatient setting, we also want to look at and provide resources for things in the ambulatory setting as well. So whether that's improving access or better utilizing our APPs, just making sure that any of that knowledge doesn't just stay local to the areas that are working on it or are familiar with it. So this next slide, you actually should be somewhat familiar with. This is one of the things that Jake presented on last month, and it's just a concept. It does not have to look like this, but you know, for the Stanford Improvement Exchange, a platform, you know, that provides access to those improvement projects that have been successful, and maybe there's a rotating model. So everything on here does not have to be static and just stationary at one point in time for however long the platform is active, right? So maybe on a semi-annual basis, we look at what RIPE projects recently were focused on, what were the impacts of that. Maybe we look at prior year efforts through ICDP or UBMD, or even department or unit focused efforts independent of some of those incentive programs, and say, hey, what were your outcomes? We think it'd be really cool to highlight that on this platform. What are some of the tools or resources that you used that other people may find valuable to tangibly help them apply and adopt to their areas? And so just for visual sakes, we think that something like that could be really cool, which is what you're seeing here. And I think the goal ultimately, again, is just going back to empowerment, giving our clinical teams the confidence and the actual resources and tools to be able to take any of those proven practices and apply them in their own setting, knowing that they are built on a foundation that has already delivered results, which I think is the gap that we're experiencing right now. So one of the things that we went back to our smaller internal group is, what are some of those attributes of successfully spreading adoption? And this also was in Jake's presentation from last time, but the 4 themes that we had identified were reducing barriers. So trying to align processes and coaches to help inform and or assist with transitions or implementations. Strong online presence, so having some sort of centralized resource or repository so that it is easier for people to tangibly go in and get things that will help them if they choose to adopt. Also looking at compelling content. So the reason I wanted to bring back the previous slide from Jake's presentation with a visual is because I think a lot of times when we have these conversations, people are talking at you or to you or presenting things with words on a screen, but actually seeing the visuals can be so helpful to begin conceptualizing what something can look like and how it can hopefully be impactful for you specifically. And then also targeted advertisement. So intentionally, and I cannot stress this word enough, intentionally reaching out and sharing the information from a central resource or database, but also outcomes of projects. So that brings us to the question, Brian. Yep.
Well, actually, before we get to the questions, can we, I have a couple of things I would like to ask the group before we get into those, if you wouldn't mind. So we've thrown a lot at you. I'd love to hear your thoughts. What I'd really be interested in knowing from the group is a couple of things. One is, first of all, I know many of you have had probably experience with different tools, different methods for spreading change, adoption, and where organizations have maybe created a repository, or they have I don't know, a list or different things. I'm curious, one, if you've been involved in any of those things, how's it gone? What were some of the things, the pros and cons of it? I also want to let everyone know that this is not, what we are sharing here is not like we're not coming up with a necessarily another one of those. It might be something like that. We don't know yet. And we don't know really what it is. This clever name, et cetera, is more of a concept. And I'm really curious to hear from people on, like, what have you seen that's really worked? What have you seen that hasn't worked? What do you think about when you hear this? Like, what's your gut response? And then those 4 barriers to adoption, I'm curious if we got them right. If what you think is there, because we had good conversation about some of those, and I think there might be some things we may have missed or maybe got wrong. So I'm curious what you all think. I threw out a lot there, but I'd love to hear your initial feedback. So I'll pause and wait for people to talk.
I can maybe kind of get started just sharing some initial thoughts, Ryan. So I think one aspect in terms of adoption, I can underscore and overemphasize the importance of readiness to adopt. And I wonder if that's kind of tied in, Dakota, with the first bullet point, about like preparing the adoptee, right? And assessing whether or not the adoptee has everything the team needs to be ready to adopt. So I think that I would like to call that out. And in my prior experience, I think there was even sort of like a quick assessment tool, a couple questions, maybe no more than 5. Oops, Dakota, I think, yeah, maybe no more than 5. That kind of helps to get the adoptee into the mindset of adopting. So that's kind of one of the things that I see that's related to what you presented. And then the other aspect, I don't know where this falls, but I also can overemphasize and underscore the importance of identifying a champion. So typically, like where I've partnered with physicians to spread from one medical center to a region, it's really because there is a champion, especially a clinical champion, who feels very passionate about the work, or the better practice. So to the extent that somebody like that could be identified and can champion the adoption, I've seen that also contribute to success of the work. And then the third point, which I don't know how it applies here, is I think it has to do with the rigor, and I think it's on one of your previous slides. It has to do with the rigor of the rigor or the level of evidence pointing to success, right? So a lot of times people don't adopt because by the time it gets published in a journal, it's like 2 years down the line. And I think that's not the intention of the what you're proposing here. You're proposing rapid adoption within our organization. So I think the
we don't know,
about,
actually.
Oh.
We're not totally sure even what it looks like. We're just proposing the concepts right now, but yeah.
Oh, cool. Okay. Yeah. And I think the notion of rigor of evidence or rigor, basically what is the data indicating success, right? And its relevance. I don't know where to put that, but in my experience, I've also seen that playing a critical role in whether the practice gets adopted. So just those three points that I wanted to share.
Yeah, thanks, Maggie. I recall, I think I know the organization you're referring to on the readiness to receive, readiness to spread, I think was what it was, and then a toolkit on whether or not you know if you're ready or not. Yeah. I think that's a good point. I think it's really excellent, because if we go back to the previous presentation that Jake gave on adopting a puppy, for example, something that I've done recently, you have to be prepared for it. If you're not prepared, you're going to fail and you're going to be tired and frustrated. And even if you are prepared, it's going to be challenging, right? So I think the preparation and the readiness is valuable. And that's where a lot of times I think of that as the culture around it. So is the culture ready? Are you ready to receive that idea? Is the unit going to receive it well, or is it going to reject it?
And I think
so there is a component of that.
Oh, sorry. Go ahead, Jake.
Yeah, I think we're diving a little into adoption, maybe a little too quickly here. One of the questions you asked, Ryan, is what have we seen work when it comes to sharing
Yep.
a best practice or sharing something across like units or departments? When you put those three words at the beginning, spread, scale, and adopt, what I've seen work best is scale in healthcare, where a senior leader or a dyad has found through evidence that this is a new way of doing things. They're now going to ask everyone to do it, and there are measures in place to hold everyone accountable to do it. I have found that to be the most effective. And I mean, even at Stanford, one of those that falls in that category is something we call CI care, a way that we talk to patients and each other at Stanford Healthcare. That was scaled. It wasn't put up for adoption. No one was asked to spread it. It was a group of leaders who said, we're doing this, and we're going to hold everyone accountable to do it. And I wish there was a place for adoption, and maybe there will be in the future as we look through this more, but as far as what I've seen most effective, it seems to be scale.
Well, and I think that goes back to a previous point that Jen made, right? Is sometimes scaling or spreading happens by accident and it's not intentional, right? And so I think part of what we're wanting to hear in terms of feedback from this group is with scaling or however the framework is set up, what is most valuable in
Yeah,
terms of,
and sorry, go ahead and finish if I did
No,
cut you
no,
off.
go ahead.
Yeah, so, and I'm not saying it wasn't intentional. I think scaling is very intentional.
Right.
I don't think it's accidental at all. I think it's very much leaders saying this is, so let's take a group of units at a hospital. We have, hopefully, a medical director, an operational leader who has governance over these units. And they want these units to do something the same way. They then, using evidence and what they've learned from maybe one of those units or maybe in their own experience, we are now going to put in central lines this way. This is our standard. And we're going to hold everyone accountable to that by measuring it across units. That's what I've seen to be most effective in the healthcare setting. Very few, if any, come to mind where adoption, where an idea was put out there and people grabbed it and applied it. Have I seen that work well? But I'd love to hear other thoughts on this. I'm not closed on this opinion. I'm just sharing some of my reflections. Looks like we have Stefan with his hand raised, Ryan.
Yeah, maybe just
Go ahead, Steve.
Just to add to that, Jake, I mean, what I've been personally struggling with is, like, my background is in organizational psychology, and what you described is like an executive leader supports the implementation, right? And I would agree, we need that in healthcare. And we tend to then work with holding people accountable, but that's a push motivation, right? Kind of like we're kind of like, it's not a pull motivation, in psychology, you talk push versus pull. Ideally, you want to create a pull motivation where you get the buy of the team members, but it's not our strength in healthcare. Like, I think we're leaning on push. But I keep thinking, how can we further create, that pull motivation and that buy-in, and essentially, not that you kind of like told something that you have to do, but that you believe that's in our all best interest and it's something I want to do, right? Because I understand it.
And that's, I kind of wonder if there's a connection in some aspect to adopting and scaling, or if it's thinking about it the other way, scaling by adoption, right? I think there is something to be said about it intentionally being considered and communicated and expected. And how does that tie in for this group with across all of your different teams in terms of your specific areas, right? Like we talked about, is there a way that we can tie whatever this concept is that we're talking about to annual planning, right? So making resources or information or data available to teams, and that's then baked into their process for consideration in terms of priority areas for the next year, right? Is there a fine line? Because sometimes, to Jake's point, there are things that are more directive in terms of it being an organizational priority versus maybe things that are a little bit more nuanced and people have the ability to choose from and then intentionally focus efforts in. And so I wonder like what that fine line is, if there is a fine line.
And maybe just to add one thought to that, Dakota, is like, and Jake, what you shared in the last presentation, right? Adopting a puppy. You want that puppy, right? It's not because someone is telling you you have to get this puppy, you know, like, and how do we create that, right? Kind of like the desire to adopt.
Mm-hmm.
Well, I think one thing that stands in our way is that adoption isn't rewarded. It's not. And if we think it is, then I think we're naive, because it's not. The way people get promoted, especially in the academic side, is through new research, new innovation. And I mean, even go to one of our monthly managers meetings where all managers come every month. What do people get awarded on? Well, there's this performance improvement award where someone's done something innovative or done something new in some way. That's what gets highlighted. I can't remember a time where someone is presented, hey, we'd like to welcome Maggie to the screen who adopted something from another unit. We want to show you how it was done. That just doesn't happen. And that to me is a culture aspect of this, that are we willing to jump in and change? Would we be willing to start rewarding imitation instead of innovation? I don't know if we are.
I don't want to challenge them to say like, yeah, I think we can, and then we should, and we already do reward adopters. It just doesn't seem like that. Like I definitely have times where someone's been like, wow, I can't believe you did this thing. And I go, well, I just read the paper and I did it and I followed the exact same steps. Like I just copied someone else's work and I did it here, so it felt new. So I bet there's already been awards of people who done something similar to that. So I'm sure we could do it more of someone who followed the same steps and it still felt new to them and we can reward it the same way. I don't know if that made sense.
So well, I wonder if you're still talking to Tamari. I see you've got a long text about the lecture series that was yesterday, and this is different. What was presented yesterday is more implementation science, but I'm curious if you might want to share more about the thing that stood out to you. Are you able to come off mute?
Yes, I had to find it. Can you hear me?
Yes.
Hi. I excuse me, got a lot of that out of that presentation yesterday. But the one thing that really stuck out to me, and I plan to take away and try to like make improvements in my team, is they mentioned that when we make interventions, they don't translate to other like teams well, because like they were only implemented in that time and there's not like a lot of training materials or information about how to roll this out and who it, you know, like if there was a PowerPoint or a 1 point lesson, to aid and guide with the adoption in other areas. Like there's not a lot of that kind of material that goes along with the intervention. So yes, I reduce falls in my unit and I did it in this way, but like, how did I train my staff? Or like, here are my training materials that I use to train staff, things like that. So I thought that was important.
Excellent. Thank you. I think this has been really good. What I would like is if, Dakota, would you now bring up those two questions? I know we've got about maybe 5 to 7 minutes left, but I would love to be able to start the conversation. What we probably will do, if you're all okay with it, is we'll continue this conversation the next time we all meet, and it'll probably be in a couple months. I'd love to be able to keep this conversation going. So we talked about this first question. What have you seen elsewhere? I'm still curious about if you have seen something, if you'd share it with us, we'd really like to know. And then this idea of how do you create a culture where so these are some things we started to touch on, and it's an interesting concept. It's like this desire or excitement to develop a culture where it is celebrated. To Jake's point, how could we make it more exciting, more there'd be some sort of an incentive, a motivation to adopt or scale, to pull. Yeah, the leadership lessons from dancing guy. That's one of my favorites, Stephen. That's pretty awesome, pretty fun. Any thoughts with this?
I have a couple of thoughts, Ryan. I hope they're pertinent to Stanford. I was very interested in the back and forth between Jake and Dakota about, if you will, the two models of spread. One model is the more voluntary, spontaneous puppy adoption model, how to make that more fast, more efficient. And then Jake's comment talking about leadership and if you will, a top-down approach. And I think they are not exclusive to one another. I'd suggest you reach out and talk to a couple of people. One is Brent James. Brent led through Intermountain Health, one of the largest enterprise-wide efforts for around improvement science. And of course, its outcome is famous at Intermountain. And he has a lot of insights on what leadership can do to start to change an enterprise-wide culture. And I know that Brent would be very willing to talk to you folks. The other person I would think could be very valuable is to reach out to Damon Santola at the University of Pennsylvania. He's studied behavior change across organizations a lot, much more akin to the voluntary model. And he talks about what are if you will, the architecture of the networks that exist, that pre-exist to your improvement changes, is very critical to the likelihood and the speed of adoption moving across. That is the classic spread model. And I know that there are resident expertise at Stanford around networks, and to start thinking about building a topography of the networks between the various departments and organizations, and using that existing network topography to speed the voluntary movement within the enterprise. So those are two areas of established research and two people that are masters of that research that might be helpful for you to talk about or talk with.
Thanks, Craig. I knew you'd come through with some names or references or articles. So excellent.
Ryan, I think something that stood out to me as well was based on Tumari's comments. and highlights, for example, the work the length of stay. NGT did this last year with the Level Up pilot, for example, right? It wasn't just them creating and providing access to the Epic tools or education for the case managers, but they had a team, a point person that helped the different areas that were involved in the pilot participate, get access to, provide education for, so on and so forth. And so I wonder if that is something else that should be a part of this thing, you know, we're talking about potentially creating, is how do we leverage and provide support or expertise for those people who are adopting or being asked to intentionally scale something, right? It's not just giving them the resources or the tools or having the platform or repository. It's intentionally aligning experts or people to help guide them through it, because there may be nuances across our inpatient units or outpatient clinics where it's not just easy to do a one-to-one application, right? But how do we still have some level of standardization while also making it easy and meaningful for it to be applicable to, you know, larger groups? And I think that also ties into leadership, buying in and having that desire, because it takes resources. You know, you can't just assign somebody to be that individual or be that group of people. It, from that perspective, I think it does come top down in terms of it being a priority to adopt or scale or spread.
So Stephen shares the ADCAR model. Yeah. So one of the things that we haven't done a lot here with our improvement work, at least on the SHC side, I can't speak to Children's, Tri-Valley, any of the other areas, School of Medicine, but we haven't done a lot with the change management side of things. So yeah, the environment for whether change can be adopted is, there's a whole assessment in the ADCAR model. So something that maybe we incorporate into this. I think it certainly sounds like a good idea. We are about at time. I want to see if Jake has anything he'd like to share with the group. I'm going to then, in a second, I'm going to put in the link to the mural board, because what I would like is if you would take a few minutes at the end, you could sign off, you could do it later, but I'll give you the link for it. If you would provide your feedback, and also possibly even any references. I know that there were some names put in here, maybe there's some articles, maybe there's some examples that you've seen. I'd love for you to put them on our mural board so that we can continue this conversation, and then be able to have that. That'll be a live link that you all can use now and until our next time we come together. You can also share topics that you'd like to continue. If you want to continue this conversation, we'll continue it like that. So Jake, you have anything you want to share? I'm going to pop the link in here for everyone.
Yeah, there was an article Harvard Business Review came out with a while back called "Healthcare Needs Less Innovation and More Imitation." Let me just read a few paragraphs from that. This will be a good one to end on and continue reflecting. So right here at the beginning, so this is the name of the article: "Healthcare Needs Less Innovation, More Imitation." Ann Roth is actually a CEO of a hospital healthcare center and helped write this. Healthcare is infatuated with innovation. We're awash in innovation conferences and organizations proclaiming innovation as a core value, even newly minted chief innovation officers, prizes for best innovation. We're not the first to have made this observation. In fact, it may have been John Pryor, the CEO of Hennepin County Medical Center, who mused about appointing a chief imitation officer for his organization. Someone whose sole job was to look outside for good ideas to bring home. After all, an idea that has already worked somewhere else is more likely to be effective than one that is completely new and untried. And then I'll just finish with a couple more things here. We want to establish an annual prize for the highest impact implementation of an idea explicitly created by someone else. We want to take the shame out of stealing from others, shake off the conceit of not embedded here, and embrace the sincerest form of flattery by learning how to imitate approaches known to work. Now, I think there's some tongue-in-cheek in this article, but I think it is somewhat interesting to think about more. And Ryan and Dakota, thanks for offering some time to discuss it.
Awesome. Okay, well, with that, what I'd like to do is thank you all for your time. I'm going to go ahead and we're going to close the meeting, but I have given you all the link. Please go in there, drop in some thoughts. We have the I like, I wish, I wonder, which is the feedback that you gave last time that we made the adaptations to this particular meeting. I'd like to do the same for next time and be able to keep this conversation going. So thank you all for your time. Really enjoyed seeing all of you. Always enjoy this time with you. So with that, I'd like to say, take care. Have a great day, and then we'll see you next time.
Bye.